Vaccination saves lives. Through the use of vaccines, we have prevented many preventable disease over the years. Vaccines are recommended throughout an individual's lifespan. Babies get their first dose of hepatitis B before they leave the hospital, and then during the first year of life at 2 months, 4 months, 6 months, 12 to 18 months. And as they get a little bit older, they'll need vaccines when they go to school, such as entering kindergarten. And adolescent needs vaccines also for mandates. 7th grade mandate, they need Tdap and also the quadrivalent meningococcal vaccine. And for 2022-2023 school year, there's going to be a new mandate for seniors entering the school. They'll need a dose of quadrivalent meningitis vaccine on their 16th birthday or anytime after. And for adults, they need vaccines also. They need vaccines for when they go to colleges, universities, for travel, and for health reasons. And adults, seniors, older adults or seniors, they have specific vaccines they need when they reach a certain age, such as the shingles and also pneumonia vaccines. We have 4 different locations here at the Health District to serve the community. We have immunization clinic here at the Decatur location, also a location at East Las Vegas, Henderson, and Mesquite. Please check our website for hours of operation and the location nearest you. Most locations are by appointment only, but walk-in is accepted at our Decatur location. You can call 702-759-0850 to schedule your appointment. We also accept most insurances. So that's no out-of-pocket cost for for most people getting vaccines. But for those, especially children without any insurance, we charge $20 administration fee, $8 for each additional. The administration fee can be waived, so we don't turn any children away for inability to pay. Flu vaccine is recommended for everyone 6 months and older. So everyone should get their annual flu shot every year. So let's get everyone vaccinated and keep our community healthy.
I'd like to tell you about our home visiting programs here at the Southern Nevada Health District. I have 2 programs that I oversee. They are completely free of charge. Our first program is Nurse Family Partnership. Nurse Family Partnership is for first-time moms. Women enroll early on in their pregnancy, and the nurse follows them until their child turns 2. Our second program is Embracing Healthy Baby. Participants can either be pregnant or they have a child under the age of 6 months old. With both programs, it's completely voluntary and, like I said, free of charge. What they do is they get partnered up with a community health nurse for Nurse Family Partnership, and for Embracing Healthy Baby, you get partnered with a community health worker and a community health nurse. In both programs, they go to the home, provide guidance, support, and resource and education to make sure mommy and baby are healthy and thriving. Participation is completely voluntary, so if anyone is interested in enrolling for Nurse Family Partnership, they would call 702-759-0779, and for Embracing Healthy Baby, they can call 702-759-0892. They can also go on the website at snhd.info/NCH for more information.
The Health District Sexual Health Clinic offers screening, diagnosis, and treatment services for sexually transmitted infections such as chlamydia, gonorrhea, syphilis, HIV, trichomonas, and we also offer pre-exposure prophylaxis for HIV, also known as PrEP, and HIV post-exposure prophylaxis, also known as PEP. In addition, we also screen for viral infections such as for hepatitis, and when we find and diagnose a patient with hepatitis, we refer them for treatment as well. In addition, we also have the congenital syphilis case management program, which is a value-added service for clients accessing our clinic, and that is a specially trained nurse partnering with a patient, so that a patient who's pregnant and diagnosed with syphilis, so that they can work together to help the mom deliver a healthy baby. The Sexual Health Clinic is a walk-in basis clinic where we encourage people to come in at 8 o'clock in the morning so that we can slot them for provider visits throughout the day. we do have a hybrid setting where we have appointments for established patients. And the most important thing is if you need an appointment or you need to ask questions, call 702-759-1700. And you can also check out our website for additional information about our services.
As part of our ongoing work to address substance use and overdose prevention in the community, our Overdose Data to Action program offers 3 key services. The first one is we offer a public-facing training website where people can learn about harm reduction and drug-related stigma and overdose prevention and all of these other areas of importance in our community. The second thing we offer is a meeting where folks can learn about all the resources and services that are happening in the community, so anyone can attend that. And third, we offer fentanyl testing strips available for pickup at our pharmacy, at Track B Exchange, and at Foundation for Recovery, where anyone in the public can access them and use them as a detection tool. For more information or to access these services, people can email l2a@snhd.org.
As part of our work in substance use and overdose prevention, and to complement the work of our community partners in Southern Nevada, we offer overdose prevention and response trainings and the distribution of naloxone, brand name Narcan, free of charge to the community. Naloxone is a life-saving medication designed to help reverse the effects of an opioid overdose in minutes. For the trainings and naloxone acquisition, anyone in the community can sign up and receive these naloxone kits. People interested in acquiring naloxone can pick them up at our pharmacy, and then agencies interested in becoming naloxone distribution sites need to contact the health district to get set up. Email l2a@snhd.org or od@snhd.org, and somebody from our team will be able to assist.
For those that are experiencing substance use, the Office of Disease Surveillance provides care and connection to services through our Linkage to Action team, also known as L2A. This group works with individuals based on their needs to identify and refer for services such as medication-assisted therapy, nutrition support, sober living, housing, and transportation. We also have a mobile unit that goes out and meets clients where they're at to provide HIV, hepatitis, and STI screenings. If you're interested in learning more about what this program does, or if you'd like to reach out to request the mobile unit, please reach out to us at 702-759-1381, extension 2, or you can email us at l2a@snhd.org.
Many of you may have some clients who want resources regarding HIV and STI testing. We can help you. So the first program is called Collect to Protect. It was started December 1st, 2020, or World AIDS Day. And so if you have clients who'd like the test in the privacy of their home, we can send them materials by mail. And for example, this is called ORQUIC. So it's a oral mucosa test, and they can do that in safety and privacy of their home. And then the other is that for additional charge, we can do other site-based testing for gonorrhea and chlamydia. So here's an example of like a test for that. When a client requests this kit, we ask them some questions, and there's going to be some follow-up to see if, in terms of not only the test results, but if we need to get a hold of them regarding the results, to get them in for treatment, or just any other questions, we're available for that. And the other part I do want to talk about is we do work with you might have heard previously in another presentation, our Linkage to Action team. So we have a mobile testing unit, and we're out in the community, and people can request our services like organizations to do, like let's say health fairs and other things like that. We also work with partners like Track B and Homeless Alliance. So we're at various parts of the community, and we do offer rapid HIV testing, Hep C testing, and sometimes syphilis testing. So we also partner with community partners, as I mentioned some, but for example, Hunt Ridge Clinic, the Center Las Vegas, the Henderson Equality Center. So if you do have like any requests or health fairs, just contact us through SNHD's website, and we can work with you on that. And also, if your clients want additional resources in terms of free HIV testing in the community, they can go to endhivnevada.org. Thank you.
The Tuberculosis Clinic here at the Southern Nevada Health District aims to capture the patients that are being identified with active tuberculosis within the community to ensure that they are starting treatment as soon as possible. One of our bigger goals is also to ensure that they are completing treatment appropriately. This means that we are following patients anywhere between 6 to 9 months to a year or over that. That is why it is also very important for us to assign a case manager to each one of our active cases. This means that they are able to work with them to overcome any barriers early on in their treatment. Another focus of our program is also to ensure that we are doing contact testing. These are close contacts to those that have been confirmed with active tuberculosis. So it is very important that we identify them early on in the contact investigation and that we test them for tuberculosis and also offer latent tuberculosis treatment. Our program also aims at providing education on tuberculosis to our community partners. So any provider that is out there and doing testing for tuberculosis and has any questions can always call our clinic. Our phone number is 702-759-1370. We're more than glad to hear about the case and offer second opinions or offer any type of resources that will guide in tuberculosis treatment.
The Southern Nevada Community Health Center is a federally qualified health center located within the Southern Nevada Health District. Our mission is to offer low-cost, high-quality healthcare and wellness services in a culturally respected environment. Part of the services that we offer at the Community Health Center are primary care services, family planning, Ryan White, behavioral health, and pharmacy services. In addition to that, we offer COVID testing and vaccination to the public. We also have a mobile unit that brings primary care and family planning services and COVID testing to where people live. We welcome private pay, full and partially insured and Medicare patients. For those without insurance, a sliding fee scale based on income and family size help ensure that quality, compassionate health care is accessible to all. No patients are denied services due to their inability to pay. Patients who see a provider are either provided office visit or telehealth visits. We ensure patient receives services in the most convenient way. Appointments can be made by calling 702-759-1700 or by visiting www.snchc.org.